Million Hearts Initiative is a national initiative with the specific and ambitious aim of preventing 1 million heart attacks, strokes, and cardiovascular events in the United States. The Million Hearts Initiative was launched in 2011, and it is co-led by the CDC and CMS. And that co-led initiative is focused on partnering with many organizations trying to look at 3 different platforms. One is keeping people healthy. The other is optimizing care, especially in those at high risk for cardiovascular diseases, and then highlighting what we call priority populations. Right now in our country, unfortunately, we have many challenges. Cardiovascular disease remains the #1 cause of death in our country. At the same time, we have many challenges. We also have many opportunities. And these opportunities are missed opportunities that we have 9 million Americans who should be taking an aspirin for secondary prevention. They already have known heart disease and they're not. We are not well controlling high blood pressure or hypertension. Right now, 50% of those with high blood pressure are well controlled. We have many individuals who should be on well-proven cholesterol medicines, statins, that we know can save lives that are not. And although we've made strides with smoking and smoking cessation, many Americans remain using tobacco or combustible tobacco-related products. I had mentioned to you this past week, the Surgeon General's report on tobacco cessation was the first released in 30 years, highlighting that although in this country we've made great strides, we have a long way to go in terms of really hitting the important areas related to evidence-based tobacco cessation. From the 1950s until 2000, the rates of mortality from heart disease and stroke dropped significantly, over 50%. And we celebrated this drop in the deaths from heart disease and stroke. What's happened, though, since 2010 or 2011 is these trends have leveled off, and then the real concern, the real crisis is that these trends are going in the wrong direction. The gains we've made, we're starting to lose ground. And there's an uptick in the rates of cardiovascular mortality and stroke mortality. And the real concern is that this is happening in those who are young to middle age, the 35 to 64-year-old age group. We identified what we call priority populations, although there are many priority populations. A priority population is African Americans with hypertension, a high-risk population for cardiovascular disease and stroke. We know there are geographic differences in our country in terms of the rates of cardiovascular disease, and there are absolutely health disparities within cities, within states, related to many social determinants of health. Another real important priority population is those who have known heart disease. By having a prior cardiac event, they're actually at the highest risk of a second event. And so we need to optimize what's called the ABCs, the use of aspirin, blood pressure control, cholesterol management, and focusing on smoking cessation in this population, as well as use of lifestyle and behavioral approaches, and optimization of use of cardiac rehabilitation, which in this country right now, only 25% of Medicare eligible patients are being referred and beginning to participate in cardiac rehabilitation. This past June, there was some really important information that came from both the CDC on the one hand. The CDC information told us what we're dying of, and we're still dying of cardiovascular disease. 1/3 of the deaths in this country are from cardiovascular events. But in this communication, it highlighted the discrepancy between what we're dying from and what we're interested in terms of the general populace as far as what we're searching on Google. So although 1/3 of the deaths are related to cardiovascular disease, only 2 to 4% of the Google searches related to health are related to heart and stroke and blood pressure issues and cardiovascular concerns. And then our media are not focusing on heart disease and cardiovascular issues and cardiovascular death anymore. I kind of describe this as a complacency that we have gotten used to our friends and our family and our neighbors and our coworkers having heart events. And that's something we can't get used to. We know we have evidence, we have the tools, and we have the ability to prevent 1 million heart attacks, strokes, and cardiovascular events. And the Million Hearts Initiative and its partners are working hard every day to try to do this.